Hello, I am Dr. Hussain Iqbal. I am an orthodontist and dentofacial orthopedist. I design smiles. I am working with COSMODENT India, Bangalore, Gurgaon and Delhi. Now, one of the most common myth that we come across is, are these noticeable? Can our friends and family recognize that we are wearing veneers? So, definitely it's a myth. This is one of a treatment philosophies which is highly discreet and almost inconspicuous. That is, it's completely customizable and the size, shape, color, the thickness, the layering, everything is highly customizable when it comes to a veneer, and it can be fantastically camouflaged or blended with the remaining teeth so that one cannot make out as to a person or the patient is wearing veneers. The second myth is that to fix a veneer, you have to cut down the entire tooth or to file a lot of tooth structure. Well, that is not completely true. To an extent, we have to do a tooth preparation, which is called a veneer preparation, but that is very minimal. The amount of tooth reduction that is done is around 0.3 to 0.4 mm of the tooth, of the enamel, the topmost layer that is removed, and that amounts to around 30% or to around 35% of a millimeter. The millimeter in itself is so less. So hardly any layer of a tooth is removed, and an ultra thin veneer can be fabricated and it can be fixed, which is strong enough to take the load of biting. So when it comes to whether a lot of tooth structure has to be sacrificed, no, it doesn't need to be sacrificed. Are the veneers for only cosmetic reasons? This is also a myth, because veneers can be used for restorative purposes also. In addition to giving a cosmetic boost or to satisfying or remedying your aesthetic needs, it can take you a long way in terms of your restorative needs also. Whenever one has severely discolored teeth or cracks or chips on the tooth surface, this can be blended or covered with the help of veneers. In cases where we need to raise the bite in the back teeth region, in the molar region, veneers can be used. So the veneers can be used to repair your molars also. They can also be used to improve the bite, and they can also be used to improve the worn down teeth. They can be the front teeth or the back teeth. So overall improvement of the health, the oral health, can be achieved with the help of veneers. Therefore, they are not just for cosmetic reasons, for aesthetic reasons, for functional reasons, and for restorative reasons also the veneers can be used. One more myth is that the dental veneers, fixing or preparing the teeth for a dental veneers, it's quite painful, which is not true. In today's times, none of the procedures, almost none of the procedures in dentistry are painful anymore, especially veneer preparation, because it's a minimally invasive kind of a procedure where there is hardly any layer of a tooth that needs to be removed. And whatever procedure that we do, usually if we sense that the patient is extra sensitive about the pain, then we give them a shot of anesthetic. The area is completely numb, so they don't know or get to know a thing about what the procedure is happening to them, and they are usually very comfortable through a veneer preparation procedure. One more myth is that veneers are high maintenance. What is not high maintenance? Your natural teeth are supposed to be actually high maintenance structures. One needs to follow a very religious dental regime in properly having to clean all your natural teeth, and the same goes for the veneers also. The veneers are artificial structures that are placed in your mouth, so the kind of care that you provide to your the natural dentition, that will determine how your natural dentition are, and that will also determine how the veneers are in your mouth. So it's not high maintenance as such. The normal way how you brush your teeth, similar way you have to maintain the veneers also. There are special toothpastes available in the market for veneers, but you can use the regular toothpastes with a lesser amount of calcium carbonate for veneers to maintain the glossy appearance and the aesthetics of a veneer. Also, the veneers usually, if they are of a good quality, they usually come up with a warranty. They come with around 10 years or 15 years of warranty. But to my experience, I have realized that veneers, they last for around 10 to 12 years. After that, it's always good to replace them. Like if you buy a car, there is a certain life associated with it. It's not lifetime, nothing is lifetime. So even if you maintain it really well, you have to, exchange it, or you have to go for other alternatives later on because of the wear and tear associated. Otherwise, the ceramic veneers, the porcelain veneers, they don't lose their color because the surface is highly glazed, highly polished. So that way it's very less maintenance, but the load that you have during your mastication, during biting, that may affect the veneers if not of good quality. So these are the myths associated with veneers. Most of them are myths, nothing true. Veneers are a very good alternative for smile design.